first and foremost, this is more of a quality improvement initiative than it is a research study, which is kind of a departure from my usual day-to-day work. It started kind of innocently a few years ago. I had a research resident that wanted to do a research project, and we sat and talked about what she was interested in and came up with an idea that she was going to look at how our university health system providers did in terms of kind of the basics. How do they do in terms of the basics of tobacco cessation? And we sat down and sort of defined what we thought the basics were, which we defined based on something put together by the U.S. Preventive Services Task Force. So the USPSTF recommends something called the 5 A's. They like acronyms, and the 5 A's are: ask every patient about tobacco, advise every smoker to quit, assess the willingness to quit, offer assistance to quit either in terms of motivational interviewing or pharmacotherapy, and then arrange for follow-up. And within the limits of our ability to tell how well we were doing those 5 things in a retrospective review of patient charts, we combined that with a survey of physicians at the University of Michigan. I wouldn't say it was a well thought out, well designed, thorough survey, but it was as good as we could do at the time, simply asking people how well they thought they did, and then compare that with what we found from reviewing the charts. Not surprisingly, what we found is that we as physicians think we do a better job than we actually do. So it was on that background that I came into contact with some people from our Department of Health, Michigan Department of Health. And it turned out they had some funds sitting around for their cancer prevention project, and they asked us to set up a systematic health system-wide change in terms of how we approach tobacco cessation.